Hi, my name is Chandler, and I am a nurse here at Rose Injectables, and my wife and I founded this place specifically so that women have a place to be heard. I know sometimes that's a little bit of a shocker coming from a guy, but at the same time I wanted to reach out and give you a little bit of information on bioidentical hormones, because what we have found over the last few years taking care of all of these women is that almost all of them complain of the exact same thing. They weren't heard. So the reason that you're getting this video is because you have obviously expressed some interest in bioidentical hormone, wondered what it was, maybe you signed up for hormones and just want a little bit more of a recap of what it does, those kind of things. That's the purpose of this video, is to give you a little bit more information about bioidentical hormones and how they can affect your life. So first things first, let me introduce myself. Again, my name is Chandler. I originally was a trauma nurse, but my wife and I started this back in 2020 as a way to help women feel heard. Not from just a physical, oh, I have a wrinkle right here, but from a top to bottom. We want to take care of you so that way you look in the mirror and feel like that's the person that I'm supposed to be. Maybe it's physically, maybe it's emotionally, maybe it's psychologically, maybe it's whatever. Our goal is for you to help you feel like your best self. So let's talk a little bit about hormones. When we get into hormones, the most important thing to understand is that, well, number one, the FDA just came out and said, hey, hormones for women are good again. So that's a great thing. But understanding bioidentical versus synthetic hormones. So when people talk about hormones, when you get hormones, you want to ensure that they are bioidentical. In other words, they're what your body already makes. The reason that that's important is because synthetic hormones are not necessarily modified to be let's call it a lock and key fashion. The lock and key fashion being bioidentical means that they fit exactly in the location that they're supposed to and do the exact same thing that they're supposed to. So when you look at bioidentical hormones versus synthetics, you know, there was a study in 2002 that talked about hormones cause cancer. Well, they were using hormones that were derived from horse urine. Well, I don't know about you, but I don't have any horse urine running through me, so therefore, why would horse urine in a synthetic hormone be something that my body would need or utilize? So therefore, that's why we specifically use bioidentical hormones. Now, the hormones that we use are about the size of a grain of rice. They're identical to what your body already makes. We implant them in your derriere, just right back here. They're about the size of a grain of rice, and they just slowly release. So as your heart beats, it passes by the pellet, picks up some of the hormones and uses it in your body. Now, some of my patients will say, well, I'd like a little bit extra, oomph these days. And I'll tell them, go out for a little walk or a little run, get your heart rate up to about 120 for 15 minutes, and you'll feel completely different the next day. Reason why is because they'll pick up more of that testosterone, goes through your body, and it works its way into your system. Now, some of our patients require testosterone. Some of them also require estrogen. So from that standpoint, we like to be able to give you either or both, depending on what you need. Now, what's important is to understand that as you age, and usually it's by age 30, you already start the decline from a woman's standpoint. And what that looks like is you slowly decline your levels of hormones, specifically testosterone. And I know a lot of people will tell you that testosterone is specific to men. Well, that's not true. Testosterone is also highly specific to women. So they slowly decline, even starting at age 30, all the way up until you get into your menopausal age. Most women are actually premenopausal as early as 30 to 35. So you will go through premenopausal symptoms as early as 30 to 35, and they will continue up until you're 50. So what do those symptoms look like? A lot of women will complain of, I'm just tired all the time. I can't remember things like, what's the name of this? Oh yeah, it's a marker. Things like that. They will say, somebody just sets me off without even trying. Or I ride this roller coaster, I'm happy one minute, I'm sad the next. Some will even say I have no libido. I love my spouse, but that's the last thing on my mind when I crawl in bed at night. All of those things can be fixed with testosterone. And what's the sad part to me is many of you will walk into your doctor's office, be it your OB, your PCP, whatever, and they'll say, well, sorry, that's part of getting older. Or, sorry, that's part of having kids. Sorry, that's just the way it is. Well, my question is, what if it doesn't have to be? What if you could still live your best life? What if you could still feel like and have the energy of a 30-year-old, even though you're 50? What if you would still have the mental dexterity that you do 20 years ago? What would that look like? So my goal is to help you identify what is deficient in your life, i.e. testosterone, estrogen, whatever it is. I've got hot flashes. I go to bed and I'm sweating. What's the reason? Let's identify it. So what does identifying look like in our office? What it is we have you come in and we do a very, very extensive blood test. I don't like to just one thing, I want to look at multiple factors. I may look at your vitamin B, your vitamin D, your thyroid completely, but also I'm going to look at your testosterone, your estrogen, etc. And the reason why, because I want to see, is there anything else that could be affecting this change in your body? So that's how we do it. I will send those labs off. I'll draw them in-house. We send them off. We get them back about a week later. Then I have you come back and we discuss all of them. It's not like a I say you do thing. It's I want you to understand your labs, your values, your hormones, so that way you can make a good decision. Because the worst thing I think medicine has done for people is said, there's a cookie cutter, one size fits all, and I say you do. I want you to be an educated patient. I want you to be able to make a choice, and I want you to come in and tell me what your choice is based on your knowledge and understanding. So let's say your hormones are low. My recommendation may be, okay, let's go ahead and do hormone replacement. Again, bioidentical hormone. You say yes or no. You're again in the driver's seat. And then if you decide to go ahead and pellet, what I do is I put a little lidocaine in here so that way you don't feel anything. And then, like I said, the pellet goes in. Doesn't require sutures or anything like that. It's really, really easy. Most of my patients say maybe, if anything, they're sore for a little bit the next day, but that's it. You wear a patch over it for 3 to 7 days. And after those days, you can peel it off. During that time, will ask you no submersion, so no hot tubs, no hot springs, anything, no bathtubs. You can shower, that's totally fine, but you can't submerge. So that's the main thing. So then a lot of my patients say, okay, what happens then? Usually, if it's your first time, within 7 to 10 days, you start to notice a little bit of a difference. And some of that brain fog may go away. Some of those achy joints, achy muscles, that may start to improve. Some of the libido may improve. Those things start to improve over time. And what happens is you start to feel like your best self.
I know.
Now, there are 2 things that drive your treatment with me. Number 1 is your safety. Number 2 is how do you feel. So 6 weeks after getting a pellet, I'm going to redraw your blood. The reason I redraw it is I want to see where you're getting to in your levels. There's kind of a Goldilocks, a sweet spot where I like you, where you feel great. So let's say you walk in and say, Chandler, I feel absolutely amazing. Great. You're in Goldilocks area, right? You're in that sweet spot. So I draw your labs, send them off, make sure you're safe, and then if you're safe, then guess what? I don't need to do a thing until I see you at that next appointment for your next pellet insertion, usually about 3 to 4 months after the initial. Let's say you say, Chandler, I don't feel a thing. I'll still draw your labs, we send them off, and maybe you're outside the window. So if you're outside the window, you may need just a little bit more. So I can give you a boost the following week, give you a little bit extra, and then you start to feel better. That's the goal. And then we just track that time after time. How are you feeling? Better, worse, the same, or improving or not. And then if we ever need to, we can do labs just to find out where you're at. The goal is for you to feel like your best self, not, I'm just getting older. That's not an excuse to me anymore. So for me and for you, my goal is for you to be your best self. So as long as you're willing to come in and have that conversation with me where you say, this is working, this is not, then we're a good fit. So hormones, how often do I get them? Every, like I said, 3 to 4 months. Another common question is how long do I have to stay on them? You don't have to do them at all. But if you feel amazing, wouldn't you want to feel that way all the way till to the end of your life? I always tell people when they do my autopsy, they're going to find that I have pellets in my derriere. The reason why is because I want to live my best life all the way till the day I die. And that's my goal with you. Help you live your best life. So if you'd like more information, you can visit roseinjectables.com. You can always call us at 719-924-4424 for more information. Our consult is free if you'd like to come in and discuss it. We're here for you to help you live your best life. Hope to see you soon.